Good day, my name is Mark Marroquin, and today I'm here to give a small presentation on testicular cancer. I want to start off with what is testicular cancer. Testicular cancer is a type of cancer that originates in the testicles. The testicles are made up of several types of cells, each of which can develop into one or more types of cancer, which are germ cell tumors, which can be divided into seminomas and non-seminomas, stromal tumors, which can be divided into Leydig cell tumors and Sertoli cell tumors, and lastly, secondary testicular cancer such as lymphoma. I will start off with germ cell tumors. 90% of testicle cancer cells develop in special cells known as germ cells. These cells make up the sperm. There's two main types of germ cells, seminomas and non-seminomas. Seminomas grow and spread more slowly. There's two main subtypes, which are classical and spermatocytic seminomas. Doctors usually tell them apart by using a microscope. 95% of seminomas are classical and occur in men between ages of 25 and 45. Spermatocytic seminoma is a rare type of cancer that occurs in men older than 65. The other germ cell is non-seminomas, which occur in men between their late teens and early 30s. Three main types. The first one is embryonal carcinoma, which is present in about 40% of testicular tumors but occur only in 3 to 4% of the time, and these tend to grow rapidly and spread outside the testicle. The second one is yolk sac carcinoma, most common form of testicular cancer in children, especially in infants. It's rare in adults. When they do occur in children, it's easily treatable. The last one is choriocarcinoma, a very rare and aggressive cancer in adults. It's very likely to spread rapidly to distant organs, including lungs, bones, and brains. The presence of these cell tumors are always a worrisome. Next type of tumors is stromal tumors. These develop in the supportive and hormone-producing tissues of the testicle. They make up less than 5% of adult testicular tumors, but up to 20% of childhood testicular tumors. There's two main types of stromal tumors. The first is Leydig cell tumors. These develop from the Leydig cells in the testicles that normally make cells hormones like testosterone. It can happen both in adults and children. Most of these tumors do not spread and are cured with surgery. The other type is Sertoli cell tumors. These tumors develop from Sertoli cells which support and nourish the sperm-making germ cells. They are benign, but if they spread, it can be deadly. And lastly, we have secondary testicular cancers, which are cancers that start in another organ and then spread to the testicle. Lymphoma is the most common secondary testicular cancer. It occurs more often than primary testicular tumors in men older than 50. The outlook depends on the type and stage of lymphoma, but the usual treatment is surgical removal and followed by chemo. Now that I have discussed the different types of testicular cancer, I'll move on to risk factors. One of the main risk factors is a condition called undescended testicles. This means that one or both testicles fail to move from the belly into the scrotum before birth. Males with this condition are several more likely to develop testicular cancer than those with normally descended testicles. Another factor is family history. If one has a close blood relative, father or brother, with testicular cancer, then the risk increases, but only a small number of testicular cancers occur in families. Most men with cancer do not have a family history of the disease. And lastly, body size can be a risk factor. Some studies have shown that tall men might develop cancer, while other studies have proved otherwise, but most studies have linked testicular cancer with high body weight. Next, I will be talking about the symptoms. Most often, the first symptom is a lump on the testicle, or if the testicle becomes swollen or larger. Some tumors cause pain, but most of the time they don't. Men with testicular cancer can also have a feeling of heaviness or aching in the lower abdomen or scrotum. Another symptom is that germ cell tumors can make breasts grow or become sore. This occurs because certain types of germ cell tumors secrete high levels of a hormone called HCG, which stimulates breast development. Some of the more advanced testicular cancer symptoms are low back pain due to cancer spread to the lymph nodes in the back of the belly, shortness of breath or cough due to cancer spread in the lungs, belly pain due to spread of cancer to the liver, and headaches due to the spread of cancer in the brain. Next, I will move on to treatment and prevention. Depending on the type and stage of the cancer, treatment options can vary. The first option is surgery, which is usually the first treatment for all testicular cancers. The first type of surgery is radical inguinal orchiectomy, which is the removal of the testicle or testicle. An incision is made just above the pubic area and the testicle is gently removed from the scrotum through the opening. The other type is retroperitoneal lymph node dissection. This is the removal of lymph nodes by making a large incision down the middle of the abdomen. This can be a complex and long operation. This surgery is done when the cancer is advanced. The side effects for surgery are minor but can include excess bleeding, blood clots, and infections. The other option is radiation therapy. This method uses a beam of high energy rays such as gamma rays or X-rays to destroy cancer cells or slow the rate of growth. It is mainly used to kill cancer cells that have spread to lymph nodes and used on patients with seminoma. Some side effects include fatigue, nausea, and diarrhea. And to prevent getting testicular cancer is a tricky subject. Many men with testicular cancer have no known risk factors, and some of the known risk factors, such as undescended testicles, family history, and ethnicity, can't be changed. So, for these reasons, it's not possible to prevent most of these cases. And lastly, white men are 4 to 5 more times more likely to develop cancer. And these are some of the statistics that you can see. Cancer is the highest in the United States and Europe, and lowest in Africa and Asia. Reason for difference is unknown. And thank you for your time. My name was Marlboro King.